Okay, so as I said, I'm working in the IPC team for WHO, and really I wanted to just try and keep this simple. I'll try and keep track of time so we don't talk too much. But obviously this is a bit of an invitation to anyone really, particularly our IPC focal points. If I say something that's contentious or you disagree with, feel free to chime in. And what we'll do is we'll try and keep it really simple. I think with infection control, there's a tendency to get a bit bogged down by the technical elements. And actually, there's a lot we can do for COVID that's quite simple. And I think certainly our IPC officers would vouch for that. It's the simple things that are the most effective. So in view of that, I thought I would just start with really, I guess, getting all of us to embrace of the idea of what the goal of infection prevention and control is in COVID. And particularly in the areas we're working in, I'm not focusing on infection control in the home, I'm talking about facilities. So the main aim of everything we're trying to do really is to keep these essential healthcare services functioning. So maintain them by containing and preventing transmission. And that will protect patients and healthcare workers, which, as we know, are fundamental to anything we do. Keeping you all safe and healthy is absolutely, I would argue, the highest priority at this point in time. Obviously, looking after our community as well. So I thought it would then be useful to go through, just really quickly, touch on transmission. And I think this maybe came up potentially in some questions. So I thought it was good to always link transmission with cleaning and disinfection. It's important to understand what you need to clean in order to understand how you need to clean, I think. And I think it simplifies it, because I think there, as I said, there's a tendency to get a little bit caught up in the technical components. If we keep it simple, how would the virus get onto people or surfaces? Then we can actually focus our attention on what's the most important thing to do. So when someone infected with COVID-19 coughs, again, I know that you all know this, but just maybe focus on where the actual virus may be going when we talk. So SARS-CoV-2 is the virus that causes the disease that we now know as COVID-19. When someone that's sick or symptomatic with COVID-19 coughs or sneezes or maybe even sings really loudly, those droplets can directly land on someone. So they may land, as you all know, they may land on someone's face, which can then enter that person or infect that person rather through their nose or their mouth. So I think that's probably quite clear, that direct transmission, so from person to person. The other way that's really important to talk about is how it spreads through surfaces, so what we would call indirect transmission. So the virus obviously can also spread or land on nearby surfaces like tables, door handles, phones I've even written there. And someone can then become infected by touching that contaminated surface and then touching their face or nose or eyes or mouth. And that's what I would call indirect, or what's often called fomite transmission. Those two key areas is exactly why those key principles of hand hygiene, cleaning, and particularly with direct transmission, wearing face masks is so critical. The other area that's important to talk about, though, and I know this came up, I apologize in advance, this is a dreadful graphic. I didn't have the best one to describe what I'm trying to talk about, so bear with me, is what we often know as aerosolized transmission. So droplets that we've just talked about that come from someone that's coughing, they're bigger, they're a bit heavier, and they fall to the ground or onto surfaces quickly. But sometimes virus particles can be present in really small little particles that are really small, and they can remain suspended in the air for a bit longer. So I think most of you are very aware of some other infectious diseases that may be transmitted in this way. I think probably the most obvious would be measles or tuberculosis, that I think we're all very familiar with. But we're talking about COVID here, and this is a topic that there's a lot of work going into right now. We can't conclusively say right now when the virus would be transmitted by an airborne manner or not. The one thing we do know is that there are certain procedures that happen in healthcare facilities that we do know generate these really small, very tiny particles that can remain, and they are what we call fine aerosols. The procedures that are done to create those fine aerosols are what we'd refer as aerosol generating procedures. So the most obvious ones would be intubation, so putting a breathing tube into someone. CPR is often talked about potentially as one, maybe doing non-invasive ventilation, definitely. Those really very intensive procedures that we do that are very close contact and generate those really fine aerosols. In health facilities, though, the important thing is that we know that there is that risk there. So we need to put things in place to make sure that transmission doesn't occur. And that really comes down to being in the right place. So not in the middle of a busy ward, for instance, where we can, in a separate room, in a well-ventilated room, and wearing the right protective equipment to protect us. And when those factors are in place, then we can keep ourselves safer. Indirect transmission, which leads us back to really what we're talking about with cleaning and disinfection, is around how long the virus can survive on surfaces. So we are still learning, and different surfaces, I think my IPC colleagues would be able to give you lots of figures immediately. I know that some of them know this like the back of their hand, but we know some surfaces, like maybe a plastic surface, like a chair or a clinical table, will potentially hold or maintain live virus on it for longer, potentially, than others. It's really anywhere from 2 hours to, potentially 7 days. And there's a bit of evidence to show maybe a little bit longer, but that main time frame is in that first few days, really. As I've written there, a lot of the factors that really relate to this is how much virus has actually landed on the surface. And like I said, what surfaces actually is. So that's why cleaning and disinfection of frequently touched surfaces, so those things that we touch a lot, is incredibly important. So just to really sum up, cleaning and disinfection, or not sum up really, just to introduce the idea, they are two different processes. So in order to feel confident that we're killing the COVID-19 virus that might be on surfaces, we need to really do both. And we'll talk a little bit briefly, I'm going to speed it up a bit, but we'll talk about what we use. But really, they are two different processes. There are some products that are around that mix the two, but I think everyone would say that it is best to make sure they're separate. Cleaning is physically removing the germs and dirt from the surfaces using soap and water or detergent. It can be any soap or water or detergent, as Edith brilliantly described. She's had to be creative and use a different one to maybe what she had before, and that's exactly what it is. It can be really simple. We wash our hands with standard soap and water. Dishwashing liquid is, the same type of vein. It's all soaps and detergents. And then we need to use a disinfectant. And we'll talk about, or we can talk later about which ones we use. The reason bleach is recommended really is because it's accessible and it's easy. But as both Josephine and Edith have already touched on, there are other ones available. But bleach is just the most, it's cheap, it's fairly accessible in the scheme of things, and it's relatively easy to mix. It's also not too toxic for people to actually put together. You need to look after yourself a little bit, but it's not something that causes a lot of harm to people unless used inappropriately. So there's two areas that I'm just going to go over: routine cleaning and disinfection, and then I'm going to touch on the cleaning and disinfection that has to happen both in isolation areas, so where we know we have COVID-19 patients, but also in areas where maybe someone who has or we suspect has COVID-19 has been, and what I would call terminal cleaning. So first of all, routine cleaning and disinfection. I would argue that this is absolutely the most important part. Yes, we need to clean and disinfect when we know an area is contaminated, but if we're not getting really good, frequent cleaning and disinfectioning happening, then it makes the second part a lot harder. So we just need to really assess the area we're cleaning and disinfecting. The main focus is really look at where people have been. So as we've talked about, this spreads via droplets or maybe certain procedures where some airborne particles or some finer droplets may be. So that's going to be the chairs that people sit on, the clinic tables, the door handles, I've written tent door openings there, the medication trolleys, the equipment we use as doctors and nurses, clinicians, and in your case, the surveillance teams, patient beds, the assessment areas, maybe the swabbing booths, the taps, toilets, all of those things. It's where bodily fluids may have come in contact with the surface. For them, as I've already talked about, we use the readily available soaps and disinfectant, but also for some medical equipment, we can talk about using 70% alcohol. And that's because it can just protect the equipment a little bit more. Bleach can be quite harsh on certain things, certainly like medication trolleys in particular, and it can really wear things down. So 70% alcohol is incredibly effective and also recommended by WHO. So routine cleaning and disinfection, as I said, it's about assessing areas, and I know the IPC officers do this all the time, making sure you have the right supplies, or, as I've talked about, different supplies might need to be utilized. Hand hygiene, incredibly important. Cleaning and disinfecting those key areas. One of the things I noticed quite a bit is that floors are really focused on, and I would argue that floors are important, without a doubt, but they're not the areas where a virus like COVID-19 will really transmit to people, unless we all start rolling around on the ground, of course. It's going to be the areas where we all touch. So if we have virus that's remained on our hands and we haven't performed hand hygiene, then that's where those virus particles may actually transmit to us. So hand hygiene, absolutely critical at every step. And the disposal of any known contaminated items is incredibly important. So just really, I should go into this in depth, but I just wanted to really, there's a lot of color in this, I apologize. Just go through how we clean and disinfect. So quick steps. There's a few more steps in it than this, and I know the IPC officers are probably thinking I've simplified it too much, but I really wanted to simplify this. So the first thing is, like I said, get yourself ready. So get the right PPE you need. So it's the same level of PPE that you would be doing anything else in. One of the things I say to anyone that's cleaning and disinfecting is, although there is a risk involved if people aren't wearing the right PPE, the greater risk of transmission in healthcare facilities is, without a doubt, being face-to-face, for instance, without protective equipment on with someone who's unwell. That's much greater that you could become infected than in cleaning. If you're wearing some protective equipment, doing hand hygiene, and making sure that, the items that need to be disposed of are disposed of, all of the key areas are cleaned and disinfected, then there's much less chance of becoming ill from that. So the first step is get your PPE, get your equipment. As I've said, we often talk about having a couple of different, and I know this is something a lot of people don't have, but maybe buckets or containers. So you could have your soap and water in one, for instance, and the disinfectant in the other. So you can actually do a two-step approach. When you clean and disinfect using some clean cloths, you can always go from a clean to a dirty area. And I've got a picture in a sec that can show that a bit more. What we recommend from WHO is that we use 0.5% bleach or chlorine solution for anywhere that's really well known to be contaminated with bodily fluids. So maybe somewhere where I would even say if we've just done an intubation, for instance, or if there's a blood spill or any other bodily fluids. So certainly in bathrooms, perhaps, if someone's unwell, we should be using the stronger bleach. And I know, I think quite a few of the hospitals in PNG have already adopted using a stronger solution for many things to make sure they feel comfortable. And then for regular surface disinfection, so maybe just, chairs or things like that, you could actually use a 1% solution. And we've got guidance around that can show people how to do it. As I said, hand hygiene, really, really, really important at the beginning and the end of the process. And really key, I think the IPC officers will talk about this, but the bleach solution needs to be made up fresh each day. It doesn't, it's not as effective if it's not. So this is the one that I just wanted to go over in a little bit more detail. So I've titled it terminal cleaning, but really what I'm talking about is cleaning an area that is known to be contaminated. So obviously an isolation area that's known to have positive patients in it, that will be known to be contaminated. But again, what I'm really referring to here is perhaps those areas where clinicians or surveillance team members or anyone really has, I guess, sometimes been caught by surprise. So maybe a patient has been there that something happened in the screening process and that you found out had COVID-19, and it's important to clean and disinfect that area. But this also the same process happens in the known isolation areas. So the first thing to do is you do need to close off that area. So as I think it was Edith talked about, she's moved around different facilities. It might just be a room. It might be an emergency department that you need to close off certain areas. But it is important to do that. And that's to protect, obviously, the staff and any other patients coming in and further transmission happening. Opening windows is incredibly important. For those aerosol particles, it's one of the best things we can do is just getting good airflow through those areas will make an enormous amount of difference. The aerosolized particles, we can talk about this a bit more. They won't stay in the air forever. They will only be there for a period of time. And as we've already talked about, the droplets won't hang around in the air. They'll fall to the ground. So it's not long after something's happened that you can go in and start cleaning and disinfection. And again, once it's done, you can actually get that area up and functioning again very quickly. We don't need to close facilities down for an extended period of time. So the second step is getting everything you need ready. So I've just put some pictures there. I apologize, they're a bit bright and colorful, but I wanted to make it simple. So it's getting the PPE you need, which, as I've said, it's going to match the same as what you're wearing. So in a screening area where you're wearing just a surgical mask, then that would be appropriate for that area. But if you're in somewhere, maybe an isolation unit where aerosol generating procedures are used, then you definitely need an N95 mask. Multiple buckets and mops, and that's really, we're going to clean and disinfect the mops anyway, but it's just to dedicate them to that area so that you then don't have any potential residual virus on those products going out to another area of the hospital. I know that everyone's quite challenged in that area, and this is the ideal. We're working on improving that for you all. We obviously need clean cloths or paper towels, even better if we had it, because we can throw it out. Bleach, bin bags, and whatever products you're using for cleaning and disinfection. We're going to use the same technique. So it's literally cleaning areas, so using a soap and water, and then disinfecting an area. We definitely need to make sure we collect all the waste from that area, seal it up, and move it to that waste disposal area. And as I've already mentioned, we're going to clean those products that we're using. So soaking them in 0.1% chlorine or bleach and allowing them to dry in the sunshine. And then, of course, hand hygiene cannot be underestimated. We need to do that so many times in the day, as I know that you all will know. So this is just a little graphic. I just wanted to show you what I meant by the cleaner areas to the dirtier areas, sorry. So when I say clean to dirtier, it will change in every room, in every scenario. So what we're really talking about is just kind of standing back before you enter and looking and thinking, right, what's happened in this space? Has someone, perhaps been resuscitated or had an aerosol generating procedure, or maybe even had sputum induction would be another example. And really looking at where droplets will be. Obviously, you need to clean all of the surfaces, but you need to focus your attention on where the most likely contamination is. So starting in the areas where are less likely to be touched or contaminated, and then working your way around to the most likely contaminated. So in this room, I know it's not a very, it's a very luxurious room, if I'm honest. 2 chairs and a bed and a toilet and a sink. I don't think many of us have that in our health facilities, but it's going from maybe those chairs. The patient bed is going to be and the bathroom are going to be your most likely to be contaminated. And that's because if someone's unwell, they'll be coughing in the bed or using the toilet facilities. But the floor, the walls, the chair will not be. So starting there first, start from your clean area and then work your way around. And that same principle will exist in whatever you're in. If it's a tent, if it's a room, if it's a isolation area, a big ward, it's always going from the least likely to be contaminated to the most likely to be contaminated. And that's just spread the virus or germs around even more. I thought I would put this slide in just as the last one, really just to show waste. It's a big topic. I know that a lot of you in your provinces are really challenged in this area. There's a lot of work being done at the moment to improve this in getting rural incinerators around the country. It's a huge challenge, and so I know that you're all trying your best to manage this. But I just thought I'd show you just some simple things. So even if we have pits, then we just need to make sure they're ideally fenced off, protected from the community, because while those processes of burning are happening, we need to make sure we're not causing further transmission. So I won't go through every single detail in that because I think I'm aware of the time, and I think it's important to answer those questions you all have. We can share this slide, and certainly I'm very happy to share lots of other information. Maybe I'll stop there for now, if that's good, Joanne.
Thank you so much, Abby. Thank you for that really comprehensive overview in a short time. Infection prevention and control is a huge topic. And you've actually covered a lot of the questions that were submitted by the survey link. So things like what to use to clean and disinfect, how long before you can go in and clean and disinfect, and how is SARS-CoV-2 transmitted. So thank you so much. It's going to be extremely helpful to our fellows, and we'll make the recording available. We are already 5 minutes over time. So we had actually prepared questions and answers, especially Edith, Josephine, and Betty, our IPC officers, provided answers to about 10 questions that were submitted. What we'll do is we're going to put those up on the website anyway, those Q&As. So Steph's just put a link to our website. So we'll work with them to get those written up and put on the website rather than cover them now, just because we are a bit over time. And I did see one question in the chat about infection control during a surge. So we'll also cover that one. Thank you so much for posting that question. So with that, I just want to once again thank all of our wonderful IPC officers and for Abby as well for your time and for describing your experiences and how you've been coping with COVID-19. And what we'll do is circulate this information and recording to our FETP network, and likely connect you IPC officers with them as well as sources of information for infection control. And that's really all I have. Thank you again for all of your help and your time today.
Thank you.
Thanks, everyone.
Thanks.
Thank you very much.
Thanks,
Thank you. Thank you.
Thank you.
Watch out for our email. with the follow-up resources and answers to questions.
No worries.
We need a PowerPoint presentation here. Thank you.
Yeah.
Yes, for
I'll
sure.
make
Thanks,
sure that
Alois.
And I can send through links and guides, or, I mean, there's a lot I tried to cram, but there's a lot we didn't cover as well. So yeah, I'll leave it to your lovely colleagues to share, and we can try and answer it all amongst all of us.
Sounds good. Thank you all very much.
Thank you.
All right.
Bye.
Cheers.
Thanks.
Bye-bye.
See you, Edith.
Cheers.
Thanks, Susan and Doreen as well.